Hello, my name is Ashanti, and I would like to introduce the topic of how we can increase physical activity amongst nursing home residents. The subject kind of hits home because I do work in a nursing home myself, and I just recently became an STNA this summer, and this is my first time being able to give one on one patient care. And I wanted to address a problem that I see every time I clock in. Why I bring this to light is our current state of our nursing home population. Currently, adults aged 70 to 85 years are reported to be the least active of all age groups. Residents spend the majority of time inactive. 79% of the day is sedentary, 20% is in light intensity activities, and 1% in moderate to vigorous activities. This poses a risk for residents and can lead to cardiovascular disease, obesity, reduced mobility, and poor functional performances. An obstacle that I want to point out right now is the lack of motivation allows for these residents to live a sedentary lifestyle. And I want to draw attention to the picture in the lower left-hand corner, especially during COVID and they're not able to see their families. They're in the bed in their rooms in quarantine, and they show the iPad here being on FaceTime with their loved ones, and this is kind of the state that they're in now. So I can see why they don't feel as motivated to do anything if they can't even see their families as well. So we talk a lot about technology in the class and how we can integrate that into exercise science. And so we ask ourselves, how could technology help us in this case if we know we have a deficit in our nursing home community? Well, what I want to bring to the table is exergaming, which is the combination of exercise with video games. And now gamers can use their entire body to play these games. We've talked about this in class previously. We read about the difference between standing and sitting creates the difference between having sedentary behaviors and being active and actually expending energy. And it's been shown that playing active video games can increase energy expenditure to a greater extent than the traditional ones. As well as going further into this and how this can help our older population, active gaming can improve measures of mobility and balance in older people. And this can be either used on its own in their own home, and it can be used as an exercise program. However, how can technology not help us so much? Well, first off, we're not clear whether these video games are suitable for older people with significant cognitive impairments or significant limitations. And usually these video games are associated with the younger generation and it's targeted towards them. And for our elderly, they're more susceptible to injury as well. These video games can result in overuse or repetitive strain injuries. As well as these injuries can occur in all ages, but especially it's worrisome when it comes to our elderly population. When looking at the plus and minuses of technology, I still believe that we can implement extra gaming in nursing homes. Two main sources I see as of right now is the Nintendo Wii and the PS2. The Nintendo Wii, of course, has gained more traction when it comes to active video gaming, and it also offers a variety of options such as Wii Fit and Wii Sports, and they both have a variety of levels and games that can cater to the interests of the resident. The PlayStation 2, which seems a little outdated, however, does cater to the elderly, and I have actually had a game developed called Dance Town, and this is specifically for the elderly to get up and get moving and be able to enjoy themselves with virtual gaming. And it allows them to keep up. It's not fast paced, and there's different levels to that as well. And so I kind of just have a quick little story. I have a resident, And every morning during breakfast, I turn tennis on for her. And she's just captivated by it. And she goes back and forth watching everything. And I just think to myself, after breakfast, why couldn't she play the Wii and have a little bit of physical activity herself and kind of maybe even feel young again, while also even helping her chances of survival in that case and creating a better lifestyle for her because she is physically active. And the good thing about this is that Wii Sports can be played standing up, sitting down, in bed. It all depends on the game you want to play, but you still can get that physical activity regardless of your limitation. Dance Town has to be played standing up, but you can use assistive devices while doing so because you can slow down the pace of the game for that resident. So they have accommodations for that as well. So to gain further insight on this intervention, I decided it would be best to interview a physical therapist and someone who works directly with the residents where I work as well, and to see what things have already been implemented, where they are on the issue, and if this intervention method of active video gaming is a possibility in the nursing home setting. Using her feedback, I created this little pros and cons list of her analysis of the intervention method, and from there, and from her feedback as well, I was able to kind of revise how technology could be used to increase physical activity. So I'll go ahead and play the interview, and you are more than welcome to skip to the time I posted if you just want to hear the summarized key points of the pros and cons.
Okay. Hi, Shannon. Could you provide a brief introduction about yourself and what your role is at the nursing facility?
So my name is Shannon Steele. I'm a doctor of physical therapy, and I've been working at Menorah Park for 8 years. It was my first job right out of PT school, and when I was going to PT school, I thought that I would get into pediatrics, and I found a new passion for helping people maintain grace and dignity towards the end of their life.
So from my understanding, you usually have like a scheduled time with them. So it's a scheduled time during the week, and then multiple times a week they have therapy sessions.
Yeah. So on our subacute side, we set times when we're seeing people because most of those residents are getting PT, OT, and possibly speech therapy on top of, just having a busier schedule. So a set time is really helpful for us, keeping things straight. But on the long-term side of things, our residents who are living at Menorah Park, we generally have a more flexible schedule.
Okay. So then outside of the time that you're with them, as STNA, I'm with them quite a lot, actually. They're not as active as they would be maybe if you were there all the time giving them therapy or giving them things to do. So a topic I wanted to bring up is how we can increase their physical activity when you're not around or another therapist and they don't have therapy for that day. What is your viewpoint on the problem of nursing home physical activity? What adversities are there?
Well, obviously right now things are even more complicated because we have people who are on quarantines for 14 days and the complications that has given. But prior to that, I feel like we were doing a much better job. It's just so hard when people are locked in their rooms and they're separated. So what we love to do is, as we see someone decline, I pick them up for physical therapy. I'm working with them anywhere from 2 days a week to 5 days a week to 7 days a week, depending on what their plan of care is and what their status is. And when I get them to a point where I feel like they're at their functional baseline, like this is as much as we're going to be progressing, then I either transition them to a functional maintenance program that's carried out by the nursing staff. As you know, being an FTNA, like how busy our FTNAs are already, the expectation then is that they're going to carry out these maintenance programs with residents. So it's something that you kind of just integrate into the day and educating staff with different ideas like that when residents can carry them out themselves is great. What I find is that they need the reminder or the prompt. You know, like, go ahead and here's your exercises, sit and do these, I'll be back and bring your lunch tray or something like that. So I think the key to success is integrating it into the day and the interactions that our SPNAs are already having with our residents, and having a consistent staff member who's invested in that resident's care and their progress and their maintaining. It promotes wellness for that resident, and then for us in therapy, we're not seeing them as frequently. They're able to maintain longer. So that's kind of our goals. And like I said, now it's a little bit more challenging with these quarantines, so we're even more restricted as far as like walking and things go, because we'll integrate walking to and from the bathroom, or if they sit out in the dining room, they could go to the big bathrooms and walk that way, and encouraging people to do that versus using the wheelchair and educating staff on that. So a lot of what we're fighting against is decreased motivation from our residents. We transition them to the functional maintenance, and when it comes time, to walk to the bathroom, they're like, just take me in the chair. And I'm sure you've seen that. Because if you're not consistently moving throughout your day, you kind of get in a rut. So we're trying to, prevent that.
That brings me to the solution or like an intervention method for them to help them stay active throughout the day. And especially with COVID, is maybe some type of portable device that we can use. And, technology has come a long way, and it's way more interactive than it was before than just having a controller and staring at a screen. The gaming culture has changed, and it's been recognized that gaming can decrease the physical activity, but then now we have all these applications, and we have the Wii console and Xbox Connect, where there's healthy gaming, which is an option to combine video gaming and exercise in the form of like competitive sports like tennis and boxing, and even things like more, serene like yoga. And it can be played with one person or someone else. And again, how you brought up COVID, especially during this time, we have a lot of residents who are in quarantine right now. They're just in their rooms, or you have people who are bedridden for the time being or bound to a wheelchair. We also keep them engaged and maybe increase their motivation to do more. And playing these interactive games might even help them become more physically active and not even really realize it. And I think using the Wii or something like that will kind of help them. What's your take on that, using technology as a way to increase their physical activity?
So I know there's so much great literature out there related to technology and engaging residents. From a clinical aspect, I have worked with it somewhat. It's mostly in a gym environment, not in a room environment. But I find it challenging with our older adults. So the 80-plus group really struggles with engaging in it and understanding it. It's not something they were familiar with prior, So it's so new that they don't grasp it. So we're definitely modifying a lot of the games and different things that those options provide. But what I do find successful in are people who are more mobile, are able to understand it, are able to engage some of our younger residents, that sort of thing. They really like it when it's a competition. So some people like to work in groups and, do things at the same time, but then others don't. They want to just do it by themselves when they have time. And I found is nice because I'm a competitive person. So who wouldn't love this? Then you meet other people, and they just want to do it for fun, or so it's kind of judging what motivates different people. But definitely the younger group of our seniors is more successful when it comes to that sort of stuff. In the rooms, I think it would be great. The problem I would see is the expense. It would definitely have to be something mobile. I'm thinking maybe on a cart that went room to room, but then we have the infection issue right now with cleaning, sanitizing, and moving something from room to room. So I don't know how we would integrate it currently, other than, you would need a lot of different devices, and then it becomes a financial burden. So that's part of the limitations, I think, with some of these programs.
Technology definitely has its challenges, It's targeted towards the older population, which is kind of not fair to them as well, because I feel like if they just simplified a little bit more, maybe we can use that with more diversity as we go along. But I like the use of the TV, that everyone has one. It's more practical, and you can have that in a room playing whenever. And on your personal opinion, when it comes to using technology in exercising, how do you view that? Do you think that technology actually helps us, or do you think it takes our attention away from the exercise?
I think that the time to set up, educate, and then complete it generally isn't as productive of a session that I could get without it. So we don't use a ton of it. When I did clinicals in pediatrics, it's super easy. Kids get it, you engage really quickly. But for the seniors, it just seems to take so long to understand it that in a physical therapy session, I don't think it's the best utilization of their time. For a life enrichment sort of thing, then yes, I think it's great. So if it's something that, maybe not during your sessions, but either with life enrichment or with Menora Park, for example, has that fitness program. And then once somebody gets it and they're consistently learning and they get it and they're using it and it becomes, easier for them to engage in, then I think you have more success with it.
So on the independent level, would you say it just depends on the level of care that they usually need? So if we have a lot of independent residents on a certain unit, the we would be more beneficial to them than maybe having them on one of our end-stage dementia or something like that, or total care units. It wouldn't be that useful.
Absolutely, as far as mobility.
Okay. Thank you so much. I really appreciate all your answers. They're really helpful. And it gave me kind of a new understanding of the technology and who's it really targeted towards and how we can use that. I definitely see that challenge of taking a lot of time to trying to explain the technology to them. I wish we could just create a console and an app that's so simple that it's just a one button click and you're done.
Right, that and then, but I feel like the simpler things get, like the Connect or wherever you don't have to do anything, the more expensive they get too.
Yes.
So you can't win. It's this would be great, but it costs so much more than this, so I'm going to get this, and then you can't really utilize it now that you have it. So that's part of the challenge. I do think, personally, in the next 10 to 15 years, I'm just thinking of my own parents who are just in their 60s, but in 10 to 15 years, I feel like I would be able to teach that population how to quickly use it.
Right, because they kind of have a better understanding as of right now with it.
Exactly, because they have more interaction with technology. So I think as we progress and, in the future, it'll be a much bigger part of what we're doing. We just aren't quite there, at least the population I'm working with. There are other nursing homes where their population is much younger. But what I'm seeing and who I'm working with is definitely on the older end of that spectrum.
Oh, I completely agree with that. Thank you so much again. I really appreciate it. No problem. You gave me some really insightful answers towards this. Thank you again.
You're welcome. And if you have any other questions, feel free to text me.
Perfect. Thank you again. You have a great one and enjoy your weekend.
Thank you. You too.
Okay. So, as we get back to that, Shannon gave us a lot of good points that really drove the message home about technology and what it can really do for us. And in general, technology is practical. You can apply it to almost everything if you use it correctly. It's portable. It can engage your audience, even create some motivation in them. And you can modify it. There's possibilities in the future, like she said, in 10 to 15 years. Her parents, they could use the Wii or whatever system we have in the future that's more advanced than what we have now. I can't even imagine it right now. They would be more so up to doing it and being more familiar with it because they're still young enough to grasp the concept now. And again, she said that a key point was the success to trying to integrate more physical activity is that it is integrative and they can do it throughout their day and not just at a set time like their physical therapy session. We want it more, and as a STNA, it'd be my job to implement this. And there's always cons when it comes to pros, and definitely during COVID we take extra precautions, especially with our elderly, and having to limit contact may require more devices, so that could be a financial burden on the facility itself. As well as she said that the population that we have, 80 plus years of age, it's not necessarily gonna work for them. So how we see games are rated E for everyone, it may not be the case because they're not gonna understand the concept of how many buttons they have to click and all the flashing lights. It might just be too much. As well as the extended setup time. So if this is a portable device and we're taking it to different residents' rooms, we'd have to go ahead and connect everything. May even have to connect to the Wi-Fi again, plug in the cords to the TV, make sure the remotes are working. So it does come up on a shorthand on that side that it may not be in the time frame that we need it because we have so many residents to care for at a time, and that setup time may be too much of a burden on the STNA themselves or even the physical therapist. So after getting all that feedback, which was amazing, I was able to revise kind of the plan that I had and how to implement this. And just to start off, we have to understand who we're going to target with this intervention. Some examples would be, she said life enrichment. So those are the ones that have met their goals in physical therapy and now just need to maintain throughout their stay at the facility, whatever reason that they're there for. And that would be the STNA having them do activities, maintaining themselves. Early dementia residents, the ones that are able to still remember things and be able to still remain focused in conversation, as well as that may be a distraction because sometimes dementia can cause behavioral problems in the nursing home. It can kind of be an outlet for them as well. Some types of rehab patients, like I know we have a gentleman who just had hip surgery. He can only move his top half right now and he's in the bed. So he can also use the Wii and play certain games that only require arm swings of some sort. In our independent residents, I mean, if they can do most of the stuff on their own when it comes to daily activities, this would be great for them to increase their physical activity. Then you would have to collect the preliminary data. So what is their plan of care? This is a teamwork of doctors, nurses, physical therapists, occupational therapists, social workers, and so on that kind of look at the needs and set goals for the resident. And the resident inputs this as well. The materials needed would be, of course, your consoles, your Wii, PS2, the game choices, Wii Sports, Fit, Dance Town, and an open space with the TV. The rooms are large enough to do some type of activity in there. And during COVID, it'd be great if they could just stay in the rooms as well and do this. To collect this data, there's a possible questionnaire that could be used, the physical activity survey for the elderly. And this just helps us get an estimate of their physical activity on a weekly basis. Basically, this can be done pre-intervention, so as a part of the preliminary data set, as well as the post. As to see if the intervention actually works, we would look at oxygen consumption. And I specifically chose the Cosmid K4B2 only because it doesn't require a whole bunch of wiring and tubes. This can be very distracting for a resident in a nursing home. It can actually even cause injury if they trip or fall or start tugging at it, stuff like that. So, and I've seen it happen, so it'd just be safer to use this model. I know that's pretty specific, but we would record this pre-intervention, during, and post. So the basic protocol would be determined by the plan of care. So how often they're going to be doing this would be based on the doctor's orders, physical therapist orders, what the limitations of the resident is, and how much they can do. And in the end, we would know if this works if your oxygen consumption improves after the intervention method. And that means that we increase the physical activity of that resident. And then also if they do the questionnaire after the intervention as well, we should see better results and see that they feel like they are more physically active after actively video gaming. So overall, a lot of references here, but technology really can be implemented quite well in the nursing home facility, but I wouldn't say in mine specifically, me and Shannon's, because we are a part of a skilled nursing home facility, which requires a lot more care, and we have a lot more significant impairments there. But in other nursing homes with different demographics and maybe younger residents, this would definitely be plausible. So I thank you for listening, and you have a good one. And I had a great time in this class. Thank you.